Circumcision is one of the common procedures of the surgery that is done in urology and andrology. Circumcision is basically done when the foreskin is very tight, a diagnosis called phimosis, and sometimes there is repeated infection of the foreskin, which is called as a belanoposthitis, which is very common in diabetic patients. So these are the two common conditions where the circumcision is done for medical reasons. Of course, there is religious reason wherein all Muslims they undergo circumcision, usually by the age of around 5 to 6 years, depending on their personal or the familial preference. So circumcision, there are various types to do a circumcision, and the conventional circumcision where the skin is cut using a scalpel and then the raw wound is sutured using a sutures or what we call as a stitches in the common words. So that is a conventional traditional circumcision which has been there since many years. The second is a stapler circumcision where we use a special sort of a stapler to do the circumcision, and the third is the laser circumcision. So in this video I will discuss about the stapler circumcision. Myself, Dr. Pramod Krishnappa, Uro-Andrologist. So stapler circumcision is done using such stapler devices. So what we do is, so suppose this is the penis and then this is the foreskin in the tip. So that foreskin is cut to a little extent and then the stapler is first disassembled. You can see in the video here. So the inner part is removed, and so the cut what is made in the foreskin, after that we introduce this internal part inside this, and then over this the skin fits in, and then we tie a suture over this. And after doing this, then we insert the stapler device. So this goes in like this, and then we tighten it. So basically the foreskin will be held at this part, and then once we tighten this, that is held firmly, the foreskin is held firmly, and then once we do this, a ring of staplers are deployed at the foreskin. Of course, all this is done under anesthesia. You will not experience any pain. Mostly we do any circumcision under IV sedation and a local anesthesia. IV sedation means you will be given some injections, most commonly a propofol injection, so that you go to sleep, and then we give an injection around the penis so that this part, the penis, is made numb. So that is when after giving the anesthesia only then we proceed with the circumcision. So once this stapler is activated and then the stapler ring is deployed there, and then we release this, and then again we untwist the inner part, and then this is taken out, and then so this now the foreskin will be cut, and then we take out this device. So that's the end, the surgery is done. So usually on an average takes as short as 5 to 6 minutes to do a stapler circumcision, as against a nearly 30 minutes to do a conventional or a traditional circumcision. So stapler circumcision, when compared to the conventional or the traditional circumcision, the advantages are it's very fast, can be done in 5-6 minutes. Cosmetically it is better because a nice ring is cut, because there is an automated device here. So a nice ring is cut as against the manually that we cut during a conventional circumcision. So cosmetically it is good. And third, it causes less pain. So these are the main advantages. The disadvantage, very rarely that can happen, is the stapler what is there that usually should fall off after 2 to 3 weeks time. If it doesn't fall off, nothing to worry, we have to just manually take it out. So that's only disadvantage with the stapler circumcision. In fact, the history, the way these stapler circumcision started was, the history goes back to the African countries, wherein these devices were initially made so that the nurses or non-doctors who are working in the hospital, they could do circumcision for patients in Africa on a mass scale. Like on a camps basis, these could be done for many hundreds of patients on a single day. That's why these devices were first invented, and subsequently these have come into the mainstream medical field, wherein these are very commonly used to do a circumcision. So if it is done by a doctor, so definitely it is safe and less pain, good cosmesis. So stapler circumcision is always a good option. See, we do recommend conventional or the traditional circumcision in few scenarios, wherein if there is lot of pus coming out from the prepuce, which means there is severe infection, in such scenarios we don't prefer to do the stapler circumcision. In that case, we manually do the traditional or the conventional circumcision so as to avoid unnecessary side effects. So there are indications of conventional circumcision and the staplers in different scenarios. We decide what is best for the patient. So please do not hesitate to consult the uroandrologist for the most latest treatments in circumcision.